The purpose of this video is to introduce you to evidence-based optometry. The lecture is going to be given partly by me and partly by Freakonomics Radio. I love podcasts, and I thought I'd introduce a couple of my favorites as we go along through the course. So, why study, or what is the nature of the study of evidence over your career? Now, this is a graph, and it has an x-axis, which shows progress over time. So you're starting out as a novice optometrist, and you go on to become an expert. And then you focus on different kinds of questions. At the beginning, your focus is mostly on background questions. That's things like, what is an eye made out of, and what does it look like? What are the vessels? What are rods and cones? What's the basics of biochemistry and all that? You get that up front, and you don't really care so much about looking at what are people doing in terms of improving patient care out in the literature, because you're just struggling to figure out what's going on. But as your career moves on, your background, you learn about the background, and now you become more comfortable with what you're doing, and you can move to foreground questions. Foreground questions are those that refer to things like, what is the current practice? It is this part, the foreground questions, that is the subject of the study of evidence. So the good news is that you need to know how to look at the evidence and interpret it, because things are going to change. What you learn today is going to change over the course of your career, and some of it you'll pick up from continuing education, but other stuff you'll need to figure out on your own. The bad news is that at least from my perspective, is that you have to take boards, and boards are primarily concerned with background questions and learning things a certain way as they are right now. So this course is important, but it's important for the future you, and not necessarily the top of your priorities as of right now. So my job is to try and get you to know enough about the future you and the future you tasks that you'll be able to remember some of this stuff and look at it. And a lot of it's going to apply now as you go through your classes and your instructors talk about evidence as it applies to today. And hopefully the things you learn in this class will help you to understand those articles and the basis for the background. But at some point you're going to be on your own, and you're going to need to know how to evaluate the literature. So what is evidence-based optometry? The American Optometric Association defines it as, and I guess I'll read this, the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of the individual patient. It means integrating individual clinical expertise with the best available external clinical evidence from systematic research. So that's the formal definition, and we're going to do our best to figure out how to read the current best information. Now, we'll give lots of examples of articles and reading articles in this course, but this is not a course of learning the current best evidence. It's learning how to use the evidence, how to read articles, how to keep current, how to read the current journal of optometry and vision science, and figure out what the people are talking about and whether or not they have come up with clinically relevant findings on some task that you're interested in. So I mentioned that this intro today is going to be covered by Freakonomics, and so I am going the homework that's going to be mentioned in a few slides. The homework is to listen to Bad Medicine Part 1, the story of 98.6 degrees. And I think you will enjoy this. I'm only requiring you to listen to part 1, but I'm hoping that while you're fixing dinner or out for a run or doing something, that you might listen to parts 2 and 3 too. I think you'll find these pretty interesting. I've also listed a few articles that are trying to convince you to accept the evidence-based concept. The British Medical Journal lists evidence-based medicine as one of the top 15 advances in science over the last few years or century or something. And it talks about what it is, but this is just kind of it's kind of letting you know how things are or why we're covering this course. And it's not just my opinion, it's other people's opinion as well. The editor of Optometry and Vision Science is Michael Twa, and he talks about asking focused questions. That's what you're going to do when we talk about reading the literature. I mean, sometimes you just read the journal, you get the table of contents, and you go in the mail, and you go down through there, and you look to see if there are some articles that are of interest. But more often, you're going to encounter a situation where you have to decide what to do for your patient, and if it's a problem, that patient's probably going to come back, and you're going to have them come back for a follow-up. In the meantime, you can ask a focused question on what is the best thing to do for them. And many of you will be in practices by yourself or with one other person, and you will need the advice of you won't have anybody to turn to, so you will go to the literature yourself. So when we talk about evidence-based optometry, what are we actually referring to? And there's basically three domains: epidemiology, and that is what does medical history reveal about what's the cause of disease. In some cases, epidemiology looks at epidemics, but that's not really what we're looking at here. We look at articles that describe how like for example, the origin of myopia. If you can't really treat a condition unless you know its cause. I mean, you can try to, but and people address glaucoma, but they don't know what the cause is, so they really can't fix it as well as they might if they knew what caused it. Another aspect of evidence-based is diagnostic activities. So how well do tests work? So making up tests is something that is devising tests for various problems is pretty common. And for example, Dr. Laukkanen developed a traumatic brain injury symptom survey. Well, how well does that test work? How likely is a person that scores high on that to have traumatic brain injury? We're going to talk about how you determine how well these tests work. And finally, one of the primary, well, they're all important, but one of the main domains is the decision to use a specific treatment. So you have a number of different options. Which one is the best? How likely is a person to respond to your treatment based on their characteristic? And just how big is the effect of the treatment? There's a lot of studies in the literature that show significance, statistical significance, but the effect isn't big enough to bother. So those are things that we will do. So here's some just general advice on reading the literature. People that write papers and submit them have worked pretty hard on this topic. They've searched the literature and they've covered a lot of different things. And so basically you should respect the advice that come from those people who have submitted to peer-reviewed journals. But it is definitely okay to be skeptical. Definitely don't check your brain at the door. Think about, keep a critical mind. It reminds me of the old Russian expression, trust but verify. I think that's true when you're reading an article. Now, one topic that will come up again and again in our discussions is this idea of samples. When you read an article or when somebody does a study, they're taking a sample. If we wanted to know the height of optometry students, and we went into class and we took the height of 5 women in that class, we could get an average number. And then if we went in another time and took another 5 women or even a sample that had 1 or 2 of the same women, the number we would get is different. It's a sample. We never know what the true height is of optometry students, female optometry students. We're not going to know, and we're taking a sample. And the fact of the matter is that the bigger the sample, the closer to the truth that you are. And just to give you some rough ideas, if you are looking at a randomized trial, there should be 30 people in each group at least before you take it too seriously. Less than 30, you're going to be a little skeptical of the results. They can be okay, but you're just not going to know as confidently as you are. I kind of think 30 is a minimum. In a propensity analysis, which is something not done too often in optometry, it's a newer design. We'll talk about it a little bit, but you should have at least 100 in each group. And in an observational study, then those are just studies that go out and survey people or kind of track them. There's no random assignment. You want to have at least 500 in as when you're making an estimate of a point. But having said that, we run into the problem of bias. Definition of bias is systematic error. Bias doesn't mean prejudice or something like that. It's just systematic error. And it occurs when the treatment and controls are not from the same underlying population. And when you try and do an observational study, say glaucoma patients versus non-glaucoma patients, you really have a fundamental underlying bias that those people are different, probably because of things other than glaucoma. So it's kind of hard to tell. Random assignment addresses bias, but random error is still in play. And one of the things we have to remember is that big samples do not reduce bias. They give you a better estimate of what the mean is of what you're looking at. But you can be getting a good estimate of the wrong number. When you read an article, or you're deciding to read an article or look at something, you look at the title first and see if the title looks like it's relevant to what you want to study. Then you review the abstract, and once you get an idea of what they're doing, you look at the tables and figures. and then see if those tables and figures are describing something that is of interest to you and meaningful, and they're coming out. The authors need to effectively communicate through those pieces of the paper. Then you continue reading if the article is relevant to your interests, so you can get at the real details. So when you're reading an article, consider the reason you decided to read the article in the first place. What was the title that was of interest to you? Do the authors directly and consistently address your question? So those are some things to consider when you're reading literature. So that's my piece for this lecture. Listen to the podcast, Bad Medicine, the story of 98.6. I think you'll enjoy it. It's a pretty interesting thing, and it gets into the reason we have evidence-based medicine. And at some point, they introduce the concept of eminence-based medicine versus evidence-based medicine. And eminence-based medicine is when a group of people get together who are experts in the field and decide what's best for everybody. And this is the way it used to be done, or even a single person who was, a famous surgeon or famous something or another, just said this is how it is, and everybody followed him. Various people had different gurus. There weren't any real studies done. It's just from this person's personal experience, and he gained a lot of influence, or he or she may have gained a lot of influence and went in that direction. Whereas evidence-based relies on real evidence, the scientific evidence and studies. And we're going to look at what makes good evidence in evidence-based optometry. So that's it for this, and thank you very much. Good luck with the class.